Good morning, everyone. Good morning. We will get started in just a minute or two. More people are coming in from the waiting room. In just a few minutes, Sharon, I'll get us kicked off. Thank you for joining us today.
Good morning, everyone. If you would, please sign into the chat and let us know who you are.
All right, folks, we're going to go ahead and get started. And as folks are coming in, we'll just continue to have them introduce themselves in the chat. Thanks again for joining us.
All right, I'm going to go ahead and get us started. That sounds great. So again, thank you so much for joining us today. I hope everyone is staying warm and being safe in this weather. So today we are going to be focusing on the Epi report that came out here, and we're going to be presenting 4 Delaware data snapshots of specific populations, specifically youth, adults, maternal and child health, and older adults. Again, we want to reiterate just throughout this presentation that the Epi report has a lot of different data, a lot of different topics and populations that we look into. And so just based on whatever your needs are and how the data can be applicable for your own work, we highly encourage you to look at the Epi report. And we're going to also just kind of go over that today and share resources of all the different work that we have on our SEO Epi site. So first off, we're going to just kind of do a little activity in the chat. So if you could just kind of put into the chat what comes to mind when you think of the Epi report, if you are familiar with it.
All right, Stephanie, since you have the slides up, I'll read some of the answers. We have great data, a one-stop shop for Delaware data, relevant data for programming and grant writing, public health data, a great tool to share Delaware data for our programming, population data on health stats. And some folks are new to this, so they're learning along with us.
Thank you so much. And then again, so the Epi report is a resource. Again, thank you so much for putting in that it's, a one-stop shop for data, especially here in Delaware. It's a really great resource for a lot of different things, such as needs assessment. If you need data for writing grant applications, evaluation planning, using the data for various presentations and public awareness materials. So we're happy to answer any questions to kind of point out anything that could be relevant for the work that you're doing in your own spaces. Then, as we kind of mentioned a little bit earlier, the Epi report has 12 different modules. Each of them have their own accompanying infographics, which we have here on our Epi report sites and products. We also have a companion guide, executive summary, point slides with a lot of different data. And so we're going to be, of course, sharing these materials later on. And then this is just a snapshot of the different data sources that we utilize in the Epi report. And of course, every year we're trying to use the most updated data that comes out from these different sources. These are the modules that we include in the Epi profile. So we look at substance use, mental health topics, and different types of populations. This is just a few examples of the infographics that we have made accompanying the modules in the Epi report. Then a slide deck that, again, captures a lot of different data that we will also be sharing that you can utilize for presentations or, similar material. And then just for the next couple slides, I'll hand it over to MJ to talk more specifically about the data nodes.
Thanks, Stephanie. I want to just highlight for you that the products on our website are free and open for you to use. So if you see an infographic or you have a presentation that you want to use and you say, hey, this slide deck would be really helpful, or I need this chart or table, you can go ahead and grab it. It's already there for you, the most recent version. So you can use it at any time in one of your presentations, or if you're doing a health fair or something like that. Data exists in a context, so we wanted to just add some notes here for you. All of this is in our companion guide, which is also online. If you're, really nerding and you want to know about statistical significance and all that stuff, those notes are in there as well. But we do want to just pull out some highlights for you that this Epi report, and we say the Epi report kind of as a universal term for the slide deck and the products that are associated with it. They draw upon 35 state and national data sources. They cover a wide variety of topics that are important to understanding behavioral health in Delaware. And they also highlight populations that are experience disproportionate risk. So persons with disabilities, for example. Again, the guidance for understanding the data, so rounding how we deal with missing cases or missing observations in the data, any discrepancies in reporting and so on is in the companion guide if you need that. And then one thing that we talked about last year, but I'll bring it forward this year as we saw it in the Epi report as we were pulling it together, the data landscape at the national level has changed. And so what's available, what's not available, how the data is spliced or available in terms of different populations has changed. And so we've done our best to bring forth the most comprehensive data, the most up-to-date data, but where we cannot, because it's no longer available at the national level, we've noted that for you. We're happy to help you on an offline conversation. If you're like, hey, this was available before and it's not, you have a good solution. And we're happy to talk with you about that. Next slide, please. And we want to emphasize word choice. So as we're going through the data next, you may see that how we would describe it may not be the way that it's described from the original source. So for example, conversations around gender, conversations around ethnicity, whether you use the term Hispanic, Latin, Latino, or in a more granular way, Mexican or Chicano, Puerto Rican, Dominican, so on and so forth. We're using data from a source, so we as appropriate, we use the labels that they use. When it's not appropriate or when it doesn't align with the mission and values, we make adjustments for that. But we also want to make sure that our presentations and our data is free of stigma. It's strength-based, trauma-informed, and culturally responsive. I think that's it. And if you have any questions about that, or you want to talk more about our data sources and where we get them from, please let me know. I'll put my email in the chat.
Great, thank you so much. So we're going to get into the data snapshots that we want to highlight from last year's Epi report, starting with youth data in particular. So real quick, if you want to put it into the chat, we just kind of want to do sort of a quick thinking activity in terms of why is it an important issue to specifically look at in youth and behavioral health.
All right, so we have prevention, solutions, and educate. I love solutions. Thank you, Mr. Miller. Early prevention and protective factors for programs and resources. Also a great answer. To target solutions, another great answer. Without understanding the epidemiology of a phenomenon, you can't design programs for prevention. Absolutely. Help us fill in the gaps to what is missing. Professional development, love that. It's important to look at youth and behavioral health because it highlights the needs in our community, to find youth groups that are at elevated risk factors. Y'all have all the right answers today. I love it.
Yeah, thank you so much. So yeah, again, all super great answers, and it is also super important to look at the activities that youth engage in, just because, of course, they have the potential for forming lifelong habits. So again, looking at risk behaviors among this population in particular, seeing if there's disproportionate risk among certain populations of youth, looking at age of first use, and if there's any patterns of that over time, so on and so forth. And then specifically with our youth snapshot today, we're going to be highlighting a few data sources, the Delaware School Survey, Youth Risk Behavior Survey, and the National Survey of Children's Health. Again, we look at a lot of different data sources as depicted with that earlier slide, with all the different sources. So in terms of what is relevant for your own needs and your own work, please feel free to reach out to us or again, refer to the Epi report as needed. But with the DSS, it is a locally funded annual survey. It highlights specifically the youngest populations that we look at, 5th, 8th, and 11th grade public school students. The Youth Risk Behavior Survey also looks at middle and high school students, and it also kind of looks at various types of risk factors and behaviors. And then the National Survey of Children's Health looks at childhood health and well-being, but is specifically surveying parents in terms of looking at those indicators. So first off, we want to look at substance use among fifth graders, which again is going to be the youngest population that we examine in the Epi report. And so this really captures interesting stuff in terms of course, for thinking about, when do youth start to utilize substances? So again, we can already see just looking at time data that there's already some fifth graders reporting that they have engaged in substances at some point in their life already. Something that we also want to point out is the fact that less than half of the surveyed fifth graders perceived a lot of risk of smoking daily, drinking daily, smoking marijuana weekly, and prescription misuse in general. Another thing I want to also kind of point out is that if you have any questions or comments, please feel free to put it in the chat. But we'll have some dedicated time to talk about the youth data in. And then, of course, we also look at substance use among 8th and 11th graders. Here, the DSS is that, we want to point out past month substance use. And so, of course, we're seeing, a good amount of 8th and 11th graders reporting these different types of substance use during that time period. Similarly, we're seeing that in terms of perceiving great risk, less than half of these students are perceiving great risk of binge drinking, as well as prescription. And then, as we kind of mentioned just a little bit ago, it's really important to look at age of first use. And so that is something that is captured by the YRBS. We see that more than 1 in 10 middle school students reported having their first drink of alcohol before the age of 11. And then among high school students in particular, 6% of high school students reported that they had first used marijuana before they turned 13. And another cool thing about the Epi report is that it also highlights population differences. So here's an example of us looking at their differences as it pertains to substance use among these students. Here with prescription pain misuse from the YRBS data, we see that the female students among both middle and high school students were more likely than the male students to report prescription pain medication misuse. And then we also want to look at gambling data. So here is an example of the DSS data noting past year gambling among students. And so here we're kind of seeing the opposite in terms of gender differences, where we're actually seeing male students among both 8th and 11th graders reporting gambling compared to the female students. And then among the students who did report gambling in the past year, we saw that both grades were more likely to bet on a challenge. So here are a few examples of what that kind of looks like among these students. And then we also want to look at associations across behavior. So this is depicted here with the gambling and substance use data. We saw that 11th graders who reported gambling in the past year were more likely to engage in past month substance use. So we're looking at alcohol use, marijuana, and vaping in the past month for these students. And of course, it's also important to note that one behavior doesn't necessarily cause the other, but it is important to kind of see the associations between these different risk behaviors. And we're seeing that gambling is a risk behavior, and that is becoming more common among these younger populations. Peer report also looks at mental health and well-being among youth. And so, of course, while it is important to look at, what amount of students are considering themselves to be in poor emotional health, and maybe considering themselves to be suffering or struggling currently, we also want to highlight, the students who feel that they are in excellent emotional health, as well as those who consider themselves to be currently striving or that they envision themselves striving in the future. And so here among the 8th graders, as reported by the DSS, we see that approximately 21% find themselves to be in current excellent emotional health, and that substantial amounts of these 8th graders are seeing themselves to be thriving currently as well as 5 years into the future. And then similarly with the 11th grade students, we're seeing, a good chunk of them having current excellent emotional health, as well as, currently thriving, as well as thriving 5 years from now. And then with self-reported anxiety and depression, we also want to highlight gender differences when it comes to these types of behaviors. So here we want to note that with the past data highlights so far, we've been looking at female and male students, but here with the 11th grade data, we were able to report students who identified as non-binary. This isn't something we're able to do with every types of, substance use and other topics that we're looking at in the Epi report, just based on the sample size. If it's below a certain threshold, we're not able to report it the Epi report, but here we were able to report it with 11th graders specifically, even though that wasn't necessarily available the 8th grade data. However, we do see that non-binary students do face a disproportionate risk when it comes to anxiety and depression. That is something that is extremely important to know and to examine in the data moving forward. And then the YRBS asked middle and high school students about if they ever considered or attempted suicide. It's important to note that they kind of asked this question a little bit differently to middle versus high school students. For middle school students, they were asked if they ever considered or attempted suicide in their lifetime, while the high school YRBS asked specifically about suicidal thoughts and behaviors occurring in the year before taking the survey. And so here we wanted to note that among middle school students, as well as high school students, about 1 in 10 tried to kill themselves at the time that they were, depending on the question that they were asked, in their lifetime or in the year before taking the survey. And then again, reporting gender differences, we saw that female students among middle and high schoolers were substantially more likely to seriously think about killing themselves or trying to attempt to do so. Great. And so thus far, the Epi report, specifically with the data that we've highlighted in this presentation, we're definitely showing, which groups are more likely to be at disproportionate risk for substance use and problems. And so a few different things that we also want to highlight is that we found that eighth grade students who indicated they had at least one disability were 3 times as likely to also report using alcohol in the past year. We saw that among 11th graders, if they reported, greater number of ACEs, that they were also going to report higher rates of anxiety and depression. Um, Again, we also saw that high school students who identified as LGBT on the YRBS were 3 times more likely to report having attempted suicide in the past year compared to students who identified as. And again, this is not because gender and sexuality are intrinsically associated with certain risk behaviors, but we want to note that there are notable associations. And so this is really important to look at, in the data as well as, the various types of work that we want to engage in. And if there's any questions about this, or if you want to kind of, dig in a little bit deeper, we have, of course, the Epi report, the specific modules that go into more detail, as well as their corresponding infographics, and that we would, love to talk more about needed. Great. So far we have looked at risk behaviors among youth, but then it's also important to highlight protective factors among youth, which is going to be highlighted by the National Survey of Children's Health. And so here with the Family Resiliency Composite Index, we see that Delaware, rates just slightly above the nationwide score as it pertains to family resiliency. And so in the National Survey of Children's Health, this is a 4-scale question that asks, parent respondents to report if their child lives in a home where them talk about what they want to do, if they work together to solve problems, if they know that they have strengths to draw upon, and if they stay hopeful even in difficult times. And then the National Survey of Children's Health also looks at various types of protective factors. And so here are examples of family level protective factors in which the Delaware scores are compared to the national ones. And so here we see that Delaware tends to mirror the national prevalence when it comes to these family level protective factors. We rate a little low in terms of, family members eating together 4 or more days a week. Family members reading to the child, and then, the child sleeps the recommended hours for the age. And then also looking at school and community level protective factors. And so again, similarly here, Delaware's mirroring the national score in terms of if there's a presence of at least one supportive adult outside the home, as well as these other indicators here as it relates to school and community for the child. All right, and so that is the youth data that we want to highlight. Again, there's so much more in the Epi report, so I'm going to pause here to see if there was anything put in the chat throughout this portion of the presentation, as well if there's any questions that want to be addressed at the time.
Stephanie, we don't have anything from the chat. We've been going back and forth about some trend data and the different opportunities for education, and we have some thoughts around protective factors. Were there any other questions, thoughts so far about what we've covered in terms of what might be available or how it might be applied in the work that we're doing? I always love the or enjoy the NSCH survey because it's things I think people can really wrap their hands around. around in terms of actions that you can take. The research is clear on how important it is to read to kids, to have that adult in their life who will read to them. Early literacy is important for lifelong learning, as well as having, dinner together. There is some, obviously there are some challenges with that, with work environments and work-life balance and so on. But the research is clear on these protective factors for children and their well-being currently and then lifelong as well. I encourage you to read some of the research around positive childhood experiences as well as ACEs. So this is a survey I really enjoy because I can talk to parents about how important it is to read to your kiddos, and not just parents, grandparents, other adults in their lives and so on, and making sure they're getting good rest, though that can sometimes be challenging. Any other thoughts, any other questions before we move on to the next section? All right, what's next?
We'll be going into the next profile, so I will hand it over to Sharon.
Thank you. And I would like to just pause and say, Stephanie presented a great deal of information in a very quick time. I mean, the idea of this webinar that we're doing is to familiarize you with the kinds of data and information you can find in the report, as well as certain select highlights. But I'd like to emphasize that this is just a very high level, very quick overview of a number of data points, but that the best thing to do is, if you have specific questions around either a particular population or a substance use rate or a mental health indicator or what have you, that you go to the modules yourselves and take a good deep dive into there. And then within that, you can even go from there into the data sources themselves, many of which are available online in a format that's interactive that you can search for if you wanted additional information. There's just no way we could present all of this information in such a short period of time. I think there are several hundred figures in the Epi report at this point. So I just wanted to point that out. And I'm loving all the interaction in the chat. I'm going to spend the rest of the time that we've got talking about three little mini profiles. As Stephanie mentioned, we have several modules in the report that actually talk about populations that are specifically identified as being at disproportionate risk. But we can go in and do our own little mini profiles by going through the different modules and gathering the information on various populations as well. So in the remaining time, I'm going to take a look at the broader Delaware adult population data, and then break it down a little bit and look at maternal behavioral health, and then finally older adults and what we can find about that. I'll be honest, I'd say the preponderance of information that we have available is on youth. I like to think of that being that they're a captive audience. It's a little harder to survey adults, particularly older adults, because we don't have a school system per se where we can go in and find this information. But there are a number of sources that we can draw upon. And so we're going to see a little bit less information about some of these populations than we do about youth, but there's still good information that we can gather. So if you'll advance to the next slide, Stephanie. Okay, so available data sources we're going to highlight in this particular section of the discussion is that we're going to look at the BRFIS data, which is an annual CDC survey conducted by the Delaware Division of Public Health. It's similar to the YRBS in that it includes a number of risk factors and protective factors in the survey. There's not quite as many questions on substance use or mental health, but there are some. We're also going to take a look at the Delaware Traffic Statistical Report that's gathered by the Delaware State Police. There is also a wonderful resource that we draw upon, My Healthy Community, that is supported by the Division of Public Health. I believe that this is currently in transition, but we're going to be taking a look at some of the prescription monitoring data prescription monitoring program data when we look at rates of opioid prescriptions. And then finally, we're going to look at the National Survey on Drug Use and Health, or the NSDUH, which provides national and state estimates on major categories of substance use and mental health indicators. So next slide. So an example of something we get from the BRFIS is some e-cigarette and cigarette use data from on adult use. And this slide depicts the current or past month e-cigarette and cigarette use by Delaware adults. You can see that although smoking rates have declined in recent decades, we still have 1 in 10 adults reporting currently smoking cigarettes. The rates are highest among the 55 to 64-year-old age group, with nearly 1 in 5 reporting current use. And vaping is a lot less common among adults than smoking cigarettes, but we do have half as many reporting vaping compared to smoking cigarettes. Younger adults, aged 25 to 34, were twice as likely as the general adult population to report vaping. Next slide. And now we have some of the NSDUH data on alcohol use among adults. You can see from this report that alcohol use remains common. More than half of Delaware adults report current drinking, that's defined as past month drinking, and the rates are highest among those aged 26 and older. Binge drinking is also an ongoing concern, particularly among the youngest adults, where we have 3 in 10 adults aged 18 to 25 reporting binge drinking in the past month. And this is higher than the general adult population, which is about 1 in 4. So alcohol use very prevalent and binge drinking fairly common. So the next slide, please. So this data was pulled from the Delaware State Police Traffic Report. And well, you know, we talk about substance use rates, but we really need to think about the consequences of excessive alcohol use and their health implications, their public health implications. So we can take a look at this slide, and you can see immediately that the DUI arrests in 2024 peak for the age group of 25 to 34, and then slightly lower for 35 to 44 and on down. So this is not, you know, this is not without its consequences. We have a number of DUI arrests occurring annually because of excessive substance use. Next slide, please. So data regarding marijuana use among Delaware adults is a timely topic given that the state has recently legalized recreational marijuana use. And you can see from this that younger adults aged 18 to 25 reported higher rates of use compared to adults aged 26 and older. According to NSDUH, 37% of adults aged 18 to 25 used marijuana in the past year, and 1 in 5 18 to 25-year-olds reported past month use. They were also half as likely to perceive great risk of harm in using marijuana monthly. So another area I think Stephanie covered in some of the slides, and something we always tend to want to look at, is, you know, what is the perception of risk for a behavior, because that does seem to correlate to higher rate. The lower the rate of perception, the higher the rate of use oftentimes. Next slide. So we also, of course, are trying to gather information on opioid use. And in Delaware, among Delaware adults, in 2022-2023, according to NSDUH, approximately 3% of Delaware adults reported misusing a prescription pain reliever in the past year. And approximately 85% believed there was a great risk of harm in trying heroin once or twice. Okay, next slide. Now, there's a lot going on this slide. This is actually something we pulled from the My Healthy Community dashboard. This is prescription monitoring program data, and it includes a series of line graphs that talk about the rates of prescriptions for various types of opioids since 2012. So you can see that in general, the rate of Delawareans filling opioid prescriptions of all types has declined over that time period. except for those that are using treatment-related prescriptions. You can see that this decline, the gray line up top, is the immediate release opioids. One of the things that I find positive in particular on this graph is that there has been a decrease in the rate of people who filled an opioid and a benzodiazepine prescription in the same month. That's declined from 3.5% per 100 in 2012 to 1.8 per 100 in 2023. And the reason that I think that's really important is because taken together, these drugs can create a lethal interaction. So some good indicators here. Next slide. These are just a couple of data points on other illegal drug use among older adults. The rates are relatively low for things other than what we've already discussed, between 3 and 4% for past month use. However, in 2021, 17% of publicly funded treatment admissions were related to substances other than alcohol, marijuana, or opioids. Cocaine, consumed by any route, was identified as a primary substance in 5% of admissions. Amphetamines were identified as the primary substance in 1% of admissions, and other drugs such as tranquilizers or hallucinogens were identified in 1% of admissions. And this is from the TEDS data source of 2021, which is our most recently available. Okay, next slide. So now we're going to talk a little bit about some of the mental health indicators that we are able to gather on Delaware adults. This chart has been pulled from the NISDA from 2022-2023. And the findings suggest that 1 in 3 Delaware adults aged 18 to 25 had any mental illness in the past year. And nearly 1 in 10 of that age group had a serious mental illness in that past year. These were much higher than those compared to adults aged 26 and older. Next slide. Oops, sorry. Okay. Although nearly 86% of Delaware adults reported good mental health, the My Healthy Community dashboard indicates that this rate has gradually declined since 2021, when it was over 90%. The Burfus also asks a question regarding depression. According to Burfus, 1 in 5 adults, Delaware adults, have been told that at some point in their lifetime they had a form of depression. The rate is considerably higher among females compared to males, at 24.5% versus 15.1%. The rates were also higher among those with the lowest income. Over 1 in 3, 36.8%, had reported having been told they had a depression at some point. So at this point, I just would like to reiterate that these are just some of the data regarding the behavioral health among Delaware adults, and you can dive more deeply into the Epi report for additional information. So now we're going to go on to the next mini profile. Next slide, please. And this is a pocket of people that we do have a lot of interest in tracking, and that's maternal behavioral health. So I'm going to ask folks if they would mind writing in the chat, why do you think that this is such an important topic to focus on? Anybody have any thoughts about why maternal behavioral health is important? Okay, well, parental health in general, we know that parental health in general can affect the development and well-being of infants and children. And prenatal substances can have a direct impact on fetal development and mental illness and mental health and substance use disorders, particularly if they're untreated. But they can also impact family dynamics, interfere with the ability to care for and protect or nurture children. And we know from the literature on ACEs that children who are exposed to trauma, such as parental substance misuse or parents that experience serious mental illness or domestic violence, that these not only have an important impact on the adults in the household, but especially on the children, and that they can have lifelong impacts. So providing maternal and child supports is a preventative strategy to enhance protective factors lifelong.
Sharon, some of the answers in the chat kind of mirror what you said, health of the child at birth, but long-term progression of the health for the child, because it can affect the outcome of babies, and what affects the mother affects the baby. I think you've covered all of those, but I think they're also worth highlighting as well.
Thank you. Okay, so we can go on to the next slide, which talks a little bit about the data sources we're going to be looking at here. In this section, we're going to look at the Healthcare Cost Utilization Project, and that's collected by the Agency for Healthcare Research and Quality. This tracks longitudinal hospital data in the U.S. And then the Pregnancy Risk Assessment Monitoring System, or the PRAMS, which is a CDC survey that tracks the overall health indicators of women before, during, and after pregnancy. But it also includes questions regarding healthcare access and insurance coverage, as well as the medical advice or the assessments that patients receive during healthcare visits while they're pregnant and postpartum. This is administered annually in Delaware by the Division of Public Health. Next slide. So on this slide, we have a chart that looks at the PRAMS 2023 data on select substance use indicators. And overall, we have relatively low rates of cigarette smoking and e-cigarette use reported prior to pregnancy, and those rates lowered throughout the course of the pregnancy. There was a slight uptick in cigarette smoking in the 3 months following birth. However, these were still lower than the pre-pregnancy rates. And we look at alcohol, while nearly 1 in 4 reported using alcohol in the first trimester, that figure dropped to about 3% in the second and third trimesters. And binge drinking also declined to less than 1% in the second and third trimesters. So all good indicators there. Next slide. And as I mentioned, the PRAMS also asks respondents questions about the healthcare guidance that they received during the course of their pregnancy. So just over, and actually before and after, so just over half of respondents reported that they had been asked about smoking or vaping in the year before becoming pregnant, but that this did increase to 9 out of 10 during pregnancy. So healthcare providers are asking about smoking and vaping during these prenatal visits. And it was also quite common for providers to ask about alcohol use as well as marijuana use and the use of other illegal drugs during their pregnancies. We can go on to the next slide. So the HCUP collects data on neonatal abstinence syndrome. And in this slide, you can see that although Delaware rates of NAS have declined steadily since 2016, it still remains double the national rate at 11.8 compared to 5.4 per 1,000 newborn hospitalizations. HCUP also asks about severe maternal morbidity. And in Delaware, the rates had been lower than the national rates, but they have increased steadily between 2016 and 2022 to 108.9 per 10,000 hospital deliveries. Next slide. So another area of concern that we have is, intimate partner violence, not only for the health and well-being of the mother, but also for the family members in the household and children. And the PRAMS does ask questions regarding intimate partner violence. According to the 2023 data, although the rates are low, approximately 3% of respondents reported having experienced violence by a husband, partner, or former partner in the year before pregnancy. And nearly 2% indicated that they had experienced this during pregnancy. Healthcare providers were more likely to ask about this during prenatal visits compared to visits in the year before pregnancy or postpartum visits. So another opportunity for intervention. Okay, now I'm going to switch gears and do a little mini profile on the behavioral health of older Delawareans. And this is something that I believe is a very important topic, but I'm going to ask once again for folks to be able to put their comments in the chat as to why they think that this is an important issue to consider. And we will have time at the end for more questions if anyone wants to talk about these last 3 profiles.
Great question from Ms. Barlow about PRAMs, that the CDC won't be conducting PRAMs. Any word on whether Delaware will fill the gap and continue? I think that's a question for our partners over at DPH, but I've heard the same thing. We've heard the same thing. This is, and obviously folks are pushing for the federal government to change that because it's such a valuable data resource. That again, I frequently say when moms win, everybody wins. So if we're not looking at what's happening with pregnant people, parenting and pregnant people, we're missing the gap, not only for those individuals, but their role in their families and in their communities. So some of our answers for your question, Sharon, are rising health concerns in older adults affecting quality of life. Multi-health complications can increase risk when using substances and mental health issues. Is PRAMS on the website? We'll get back to that. That's a different question, Dr. Hurt. We'll get back to that one. Any thoughts on older adults? Any more thoughts on older adults?
I think that a lot of those have been summarized pretty well, but yes, the body metabolizes substances more slowly. There's greater likelihood of interactions with medications as well as with health conditions. And there is greater risk for abuse, neglect, and self-neglect if there is substance use involvement. And I think overall, one of the biggest reasons we want to look at this is because the population is aging and people are living longer and there are greater needs. I feel that I like what Ronette has to say. Older adults have unique vulnerabilities that are important to understand before policies can be designed for prevention. And it is true. So when you combine all these factors, this is a very important topic to consider. And as you're going to see, this is the one that we have probably the least information on, unfortunately. So without further ado, let me just get into the data that we can talk about. So let me go to the next slide. In this section, I'm going to take a quick look at some data points from the Division of Forensic Science annual report because they do break down information on homicides and suicides by age in Delaware. The BRFIS is another survey that does allow us to sort the data by age as well. And the TEDS has the ability for us to take a look at admissions to publicly funded treatment facilities by age as well. So we're going to take a look at those data sources. And if we'll go to the next slide, we're able to gather some behavioral, some BRFIS data on vaping and tobacco. Vaping and tobacco, 1.2% of adults aged 65 and older reported being current e-cigarette users, and 7.7% reported being current smokers. So relatively low, especially on the e-cigarette use, but still a substantial number of folks smoking cigarettes. Okay, next slide. And I told you, we talked a little bit about the treatment admissions data, and even though it's far less common for older individuals to be admitted, there were still 6.5% of admissions in 2021 were for individuals aged 61 and over. So it does affect older individuals, substance use, and there is need for treatment. And then finally, we're going to take a look at a data point from the from the Delaware Annual Forensic Report, and that is the homicide data. And that 4 out of 66 homicide deaths that occurred in Delaware involved victims aged 60 and over. So when we tend to think of trauma, a lot of times we think of ACEs, we think of children and youth and the trauma that they experience, but it's important to recognize that older individuals can be victims of trauma as well at older age, but also throughout the course of their life. So these are just a few things we were able to pull out. As I mentioned, there there are data sources, like for instance, NISDA and other individuals, another individual data sources may report other indicators. But what we're only highlighting here are things that we pulled out in the Epi report. So without any further comment on older populations, I'd just like to open it up to questions in general that you might have about any part of this presentation today or any of the resource materials that we've talked about. I
You
know
know,
it's
Sharon, as you were talking
I'm
about
sorry.
the older adults, I was thinking that, how they act as role models for our younger people. So folks who are providers on the call who maybe work only with younger folks. LACC has a great program for grandparents, their abuelos program. But what a role model and how young people look to those older adults. Having done some focus groups in Delaware, some of the opinions around cannabis, for example, and young people are informed by, if they have older adults in their family who are using medical cannabis for chronic health issues and things like that. And so it's important to kind of think of our older adults not only in their individual needs, but the important roles that they play in their families. And I see a question from Miss Capelli. Go ahead and come off mute,
Not,
ma'am.
not really a question, but just to piggyback on what you're saying. I mean, not only are they role models, but we live in a generation now where many grandparents are raising their grandchildren. So it's important to make sure that their mental health as well as their control over their substance use, is looked at just as much as the younger population because of the fact that they are primarily the ones that are stepping in to raise the grandchildren and are the ones that are contributing both ACEs and protective factors for their kids. So I think in the multi-generational family that we have here in the U.S., especially with the parents going to work and how it's changed the dynamic during COVID, we have that opportunity to look at unique opportunity to look at, grandparents raising children and their role in the development of the children.
Yeah, I think that everything you just said, Katie, is spot on. There's tremendous need in many different ways, social support as well as treatment, specialized treatment as well, because the needs are specialized in many ways. And the impact is great. The role that older adults play is is great. It always has been. But I think the fact that we're living longer, working longer, all of these factors contribute to just the amount of influence there is there.
With our last few minutes, are there any questions, comments, how to access the data? I think someone mentioned in the chat earlier, lots of times folks use this data for grant applications, for programming, for presentations that they do within their organizations, but also within the community. So we're happy to talk a little bit about that if you'd like. Community influence is everything. What individuals see as normal become the standard. Absolutely. Any other thoughts? Can we go to the next slide, please? And the next one. Thank you. Any other thoughts, comments, questions? It's a lot of information to digest. We'll put the link for the website again in the chat. But if you have any follow-up questions, feel free to reach out to us so that we can walk you through some things. Some of those portals, if you're not in them every day with PRAMs or not PRAMs, excuse me, YRBS or NISDA can get a little tricky. Happy to walk you through it so you can find the information you're looking for if it's not already in the Epi report.
I also would like to say, we always are looking for questions, and we need to be informed by you all as to the kind of data that you're looking for. So please don't hesitate to reach out. We may not have it, it may not exist, but we would still like to know what your needs are. I mean, sometimes that's more important than being able to know what does exist, right? But please remember that the SEOW exists to help. You know, we try to customize our work to what's needed by our constituents. So please don't hesitate to reach out to us at any point with questions or thoughts. And also, we know that you are all data partners. All of you out there are data partners, and we appreciate the feedback that you give us as well as the access to information that you share with us. And thank you for that.
Okay. Seeing the notes here from Ms. Capelli and Mr. Miller, we'll definitely follow up with you afterwards around that, maybe have some more conversation and what that looks like. All right, folks. Well, I'm not for keeping folks just to keep folks. So I appreciate your time and your participation and all of those things. We will post the recording. So if there are some folks who weren't able to make it within your organization and you want to share the slides, and the recording will be available on the website that we already shared. And if that's it, I hope you have a wonderful day and thanks for joining us.
Thank you all.